I have a very interesting question from a patient, and it says augmentation in a lift 11 years ago. Wondering if it's time for a revision. So just the fact that it's been 10 years, implants last 10, 15 years, it certainly indeed is time for a revision. Because the risk for rupture, malposition, rippling, among other things, go up. I have more fullness than I used to. Now remember, as you will see, there is more, quote, if you will, bottoming out on the right than on the left. There is the cut around the nipple areola. No two sides are the same. You may have a capsular contracture because you mentioned over here that also my left breast has a sort of dent that's gotten worse over the years. And so this dent that you're talking about may be part of the capsular contracture. So as you will see, look at this nice contour, and now there is that dent. So this is capsular contracture. One has to always think breast cancer as well. So you have to get appropriate screening with a mammogram and self-monthly breast exam, maybe an ultrasound, and as recommended by the breast center, maybe even an MRI. Remember, if you have had silicone implants, you are recommended at year 3 to get an MRI, and then every 2 years there onward. So one has to be always thinking if there is any irregularity of the breast, you must rule out breast cancer. Remember, 1 out of 8 or 9 women will get breast cancer. How do you know it's time for a revision? Because the length of time that has occurred because of the asymmetry, and then you may have a capsular contracture. Look how small this site looks and how, quote, normal and even. So this is possibly contracted up. So a physical exam by a board-certified plastic surgeon is key. And remember, there's always going to be a bottoming effect. Over time, the implant, because of its sheer weight and the inflammation that it causes, will cause the implant to bottom outward and downward because of the sheer gravity. Even when the implants are placed below the muscle, the implants there's nothing sturdy to hold the patient, and so the implants just go downward and outward, and this is where the contracture on one side may be causing the asymmetrical differences that the patient is experiencing. So hopefully that answers the question. This is Dr. Khan, Executive Plastic Surgery.